Welcome to the Deep Dive, where we take your sources and distill them into the most important insights. Today we're plunging into a topic that's often, well, a bit of a medical mystery. Pancreatic disease in horses. It's a condition considered rare and, frankly, quite challenging to diagnose. Our mission for this deep dive is really to unpack the complexities of recognizing and managing pancreatic issues in our equine friends. We'll look at why the common tests aren't always what they seem and what new advancements might be, finally giving vets a clearer picture. You provided us with two incredibly detailed excerpts, and we're going to extract the essential nuggets so you can feel truly informed on this pretty nuanced subject.
Exactly. Historically, reliable and specific blood markers for equine pancreatic disease have been, well, frustratingly absent. It's a stark contrast to small animal medicine, where tests like PLI, that's pancreatic lipase immunoreactivity, are pretty well established. We'll dive into why that's been the case and how the diagnostic landscape is finally starting to shift a bit.
Okay, so the challenge begins with how elusive this condition is. You mentioned it's considered rare and difficult to diagnose in horses. What makes it so uniquely challenging to pin down?
What's truly fascinating here is just how rare it seems to be, and therefore how challenging it is to even suspect in a horse sometimes. While you might see, very low levels of enzymes like amylase or lipase on a routine blood panel, they're rarely measured specifically to check the pancreas. And that's because primary pancreatic disease and also paniculitis, that's inflammation of the fatty tissue, are genuinely uncommon in horses. The reference ranges for these enzymes are typically extremely low. We're talking tiny numbers if the pancreas is healthy.
It's interesting. So if those basic blood tests aren't really reliable indicators on their own, what about the enzymes we typically associate with the pancreas, like amylase, lipase, and trypsin? Why aren't they the straightforward answer in horses?
Right. This raises a critical question about specificity. It's kind of counterintuitive, but in horses, the usual suspects for pancreatic issues, like amylase and lipase, can often send you down the wrong path. Let's take amylase first. This enzyme helps digest carbohydrates. Now, while the pancreas produces it, here's the twist. Amylase is not specific to the pancreas in horses. Significant amounts actually come from the small intestine and, to a lesser extent, salivary glands and liver, too.
So elevated amylase doesn't necessarily point straight to the pancreas then.
Precisely. It can be elevated in horses with gastrointestinal disease, which, as you know, is a very common issue for horses. Think colic, enteritis, maybe even a twisted gut. So while pancreatitis can cause high amylase, elevated amylase alone is considered a poor indicator because it lacks that specificity. Oh, and kidney disease, where the body isn't clearing waste properly, that can also lead to higher concentrations.
Okay, so amylase is tricky. What about lipase?
Lipase digests fats, also produced by the pancreas. However, historically, the conventional tests for lipase have shown limited pancreatic specificity in horses. They pick up activity from the stomach, the small intestine, and the liver as well, not just the pancreas. And we also need to be aware of sort of lab nuances.
Yeah.
Hemolysis, that's when red blood cells break open in the sample, can inhibit lipase activity. And leukemia, too much fat in the blood, can give a falsely low reading in some tests. All of this just makes interpretation harder.
So amylase and conventional lipase are problematic.
Yeah.
What about TLI, trypsin-like immunoreactivity? You mentioned that one too.
Yes, TLI. Now, this one is produced exclusively by the pancreas, so you'd think, great, this must be it. But in dogs and cats, a significantly low TLI is the gold standard for diagnosing exocrine pancreatic insufficiency, or EPI. That's where the pancreas doesn't produce enough digestive enzymes. But here's the kicker for horses. EPI is extremely rare in this species, almost unheard of. So TLI isn't routinely used for its diagnosis or really for pancreatitis either in horses. Its diagnostic usefulness for pancreatitis in horses is generally considered, well, poor or unestablished.
Wow, okay. So with those traditional roadblocks, it really sounds like we needed a breakthrough here. Has any recent research offered a more specific marker for pancreatic issues in horses? Is there something new?
Yes, absolutely. This is where it gets really promising and quite interesting. Recent research has focused on something with a bit of a mouthful of a name. The 22-odolyl-rac-glycero-3-glutaric acid, 6-oro-methylresorphin ester acid. Let's just call it the DGGR lipase
The
acid.
DGGR lipase, got it. Much easier.
Definitely. The key here is that this assay is considered more specific for pancreatic lipase activity, and importantly, it has been validated for use in horses.
Okay, so more specific. How does that translate in practice? How do vets interpret it?
Well, preliminary studies show elevated DGGR lipase levels in horses with gastrointestinal disease, especially colic cases. Interestingly, higher concentrations have even been linked to more severe pain in these colic cases, which suggests there might be some degree of pancreatic inflammation, pancreatitis, accompanying these serious gut issues.
But there are limitations, right? It's not a perfect test either.
Exactly. While it's more specific than the traditional tests, an elevated DGGR lipase doesn't definitively confirm primary pancreatitis. It can still be sort of a secondary reaction to other severe GI problems. And it's often difficult to get definitive postmortem confirmation in studies to really nail it down.
What about the levels? Is there a range vets look for?
Yeah, that's a good point. For healthy horses, studies suggest normal levels are typically quite low, often below 20 UL, maybe in the 9 to 21 range. But here's the crucial part. Markedly increased values, specifically above 200 UL, are highly suggestive of significant pancreatic involvement. We're talking about a tenfold increase, or even more sometimes. That really raises a red flag.
Okay, bringing this all together then,
Oh.
how has this DGGR lipase assay specifically changed the diagnostic approach for vets dealing with suspected pancreatitis in horses? What's the impact?
It means we finally have improved diagnostic utility. It's a big step forward. The DGGR lipase assay offers the best currently available blood marker for pancreatic involvement. It's not perfect, but it's our best shot right now from a blood test. Elevated values, especially those really dramatic increases we just mentioned, should strongly raise suspicion of pancreatitis, particularly in horses showing compatible clinical signs, severe or recurring colic, not wanting to eat, lethargy, maybe that icterus, the yellowing.
It sounds like while blood tests are finally improving, they're not the whole story, are they? What other diagnostic tools are crucial for evaluating suspected pancreatic disease in horses? It sounds like a puzzle.
That's a critical point. It absolutely is a puzzle. Because blood enzyme markers still have limitations, clinicians have to rely on a combination of approaches. It's like detective work, really.
So what pieces does that puzzle involve?
Okay, first, clinical signs. These are often nonspecific, unfortunately. They can point to many different problems. But you might see acute, severe, recurrent, or just intractable colic, anorexia, lethargy, depression, maybe weight loss in chronic cases. Sometimes icterus if there's a bile duct obstruction too, fever, and rarely diarrhea or signs they're not absorbing nutrients properly. More specifically for pancreatitis, you might see a colic, gastric reflux coming up the tube, a rapid heart rate, tachycardia, and even signs of hypovolemic shock. And don't forget hyperlipemia, that cloudy, fatty serum look, which can cause depression and anorexia too.
Okay, so signs are suggestive but not definitive. What else? Ultrasound.
Yes, abdominal ultrasound. It's a valuable tool for trying to see the pancreas, though its location, tucked away in the right dorsal abdomen near the duodenum and right kidney, can make it challenging to image completely. You might not get a perfect view, but findings suggestive of pancreatitis could include the pancreas looking enlarged or darker, maybe fluid around it, a distended pancreatic duct, or brighter mesentery, that tissue holding the intestines around the pancreas.
Right. And what about analyzing the fluid in the abdomen? Peritoneal fluid.
Good point, peritoneal fluid analysis. So, taking a belly tap. Comparing amylase and lipase activities in this fluid to those in the blood can be helpful. Higher concentrations in the abdominal fluid than in the serum suggest pancreatitis, but again, it can also be a nonspecific finding. It could just mean peritonitis or inflammation of the abdominal lining generally.
More suggestive clues rather than answers. Any other lab tests?
Yeah, other lab findings. Sometimes increased serum GGT, that's another enzyme. Gamma-glutamyltransferase could indicate pancreatitis, as GGT is concentrated in the pancreas, as well as the liver. Also looking for very high serum triglyceride levels, say above 500 milli-GDL, or high non-esterified fatty acids. That can indicate hypolipemia, which is a potential cause or complication, especially in breeds like ponies, donkeys, or miniature horses. They're more prone to it.
So we've got clinical signs, ultrasound, belly taps, other blood markers.
Yeah.
What about more definitive methods?
Well, that often leads to exploratory laparotomy, so abdominal surgery. This is frequently the definitive method for diagnosing pancreatitis in horses while they're alive. Seeing an inflamed, swollen, or even necrotic, dead-looking pancreas directly confirms it, and you can take biopsies then too. Surgery might be indicated anyway in difficult colic cases where you can't find the cause of pain or if there are signs of a small intestinal obstruction.
And I suppose the other definitive way is less ideal.
Yes, sadly, necropsy. A post-mortem examination is, unfortunately, how pancreatitis is very frequently definitively diagnosed. You can see the changes clearly then.
Okay, so if a diagnosis is made, maybe through surgery or a combination of these clues, what's the treatment approach for equine pancreatitis.
Right. Treatment is primarily supportive and symptomatic. There's no specific cure, no magic bullet for the pancreatitis itself, or for panniculitis either. It really depends heavily on the underlying cause, if one can be found.
So what does supportive care actually involve in these cases?
Okay, key aspects include, first, pain management. Analgesia is crucial. We often use NSAIDs like flunixin meglumine, and for severe pain, opioids like butorphanol, maybe morphine or fentanyl patches.
Fluids too, I imagine.
Absolutely. Fluid therapy. Intravenous fluids are vital for hydration, correcting electrolyte imbalances, and ensuring good blood flow, good perfusion to the tissues.
What about feeding? That seems complicated if the digestive system is involved.
It is. Nutritional support needs careful thought. Initially, in really acute severe cases, withholding feed-going MPO, nothing by mouth might be considered to try and reduce pancreatic stimulation. But this has to be very carefully balanced against the risk of causing hyperlipemia, especially in those at-risk breeds like ponies and minis. You can make things worse. Once feeding resumes, the goal is small, frequent meals that are low in fat and sugar, but high in fiber. And in some cases, if MPO goes on for a while, they might need parenteral nutrition, IV nutrition to get calories in.
And managing other problems that pop up.
Yes, managing secondary complications is huge. This includes treating things like gastric ulcers, which are common with stress and illness, maybe using omeprazole, treating ileus, that slowdown of the gut, maybe with prokinetics like lidocaine infusions, managing endotoxemia if gut bacteria get into the bloodstream, treating fatty liver, hepatic lipidosis, especially in overweight ponies or miniatures, and rarely even managing diabetes mellitus if the insulin-producing cells in the pancreas get damaged.
Do antibiotics play a role?
Antibiotics only if a bacterial infection is actually suspected. Primary pancreatitis is often sterile, meaning no infection, so antibiotics aren't always needed and shouldn't be used without cause.
And surgery. You mentioned exploratory surgery for diagnosis.
Right. Surgical intervention isn't usually aimed at the pancreas directly, unless maybe draining an abscess, but surgery might be necessary for the underlying conditions causing the pancreatitis, like fixing a severe small intestinal blockage.
Okay, so it's intensive supportive care. What's the bottom line then? What's the outlook, the prognosis for horses diagnosed with this condition?
Generally speaking, the prognosis for equine pancreatitis is considered guarded to poor, especially in severe acute cases. Unfortunately, many horses do succumb to the disease itself or its complications. It can be very serious.
Is there any hope for recovery?
Yes, there is. If the pancreatitis is mild, or if it's secondary to a gastrointestinal condition that can be successfully treated, then some horses can recover with really aggressive supportive care. But chronic pancreatitis can lead to ongoing problems like recurrent colic, weight loss, or very rarely, that exocrine pancreatic insufficiency or diabetes we talked about. And complications like leakage of those enzymes, amylase and lipase, into the abdomen can cause a non-septic peritonitis. Plus, issues like small intestinal obstruction, the pancreatitis itself, and hyperlipemia can, unfortunately, be fatal. So ongoing patient monitoring is absolutely crucial. Repeat blood tests, maybe repeat belly taps, and just watching very closely for any signs of colic returning.
Wow. That was incredibly insightful. It really paints a picture of how complex and almost detective-like diagnosing and managing pancreatic disease in horses truly is, from the tricky markers to the need for multiple approaches.
It absolutely underscores the constant evolution of veterinary diagnostics, doesn't it? And the critical need to look beyond just a single test result to see the whole picture.
So ultimately, what's the key takeaway for you, our listener? I think it's that even conditions considered rare, the depth of understanding required is immense. And given how often pancreatitis in horses can be secondary to other, perhaps seemingly unrelated, gastrointestinal issues, and how challenging it remains to definitively diagnose, this raises an important question, something maybe to mull on. How might a deeper understanding of the interplay between the horse's entire digestive system and its pancreas lead to even more effective early detection, or perhaps even preventative strategies for this very elusive disease?